Summer is on the way. Hooray! Well, don't let needless illness spoil your summer health, whether you're going on holiday or staying here in the UK. There are lots of things that we tend to forget about summer. There are health risks. Sunburn obviously is a much bigger health risk if you're somewhere really hot, but it can be an issue even here in the UK. And don't forget that while we need some sunshine to keep our levels of vitamin D topped up, any sunburn is a sign that your skin has been damaged. Skin cancer kills, and about 90% of deaths from skin cancer come from a condition called malignant melanoma. You can find out more about the warning signs by looking on Patient UK under malignant melanoma. But that is almost all due to sunburn. Other skin cancers, which can cause severe problems but are much less likely to kill you, so you do need to avoid them as well because they can cause problems, are caused by overall lifetime sun exposure. So if you're going to be safe in the sun, make sure you apply regular sunscreen, at least factor 15, 20 to 30 minutes before you go out. Reapply it every couple of hours and after you've been swimming, and try really hard to avoid getting burnt. What else do you need to think about? Well, if you're going abroad, and indeed even in the UK, insect bites and stings can be a real pain. A few people will get severe problems. Some people are allergic to wasp or bee stings, but for most people they're a minor irritation. New research just out suggests that sadly many of the over-the-counter lotions and potions that we use probably don't make a lot of difference. Antihistamine tablets may help, they're worth a try, they won't do any harm, but there's not much evidence they do much good. Steroid creams, again, not much evidence, and you mustn't use them on your face or on broken skin. So some of the creams, maybe with a local anaesthetic, may be worth trying because they can relieve the symptoms, but they can also cause sensitization, cause allergic rashes on your skin. So much better, if you can, to try and avoid them. If you're going anywhere where there are likely to be a lot of insects, use insect repellent. Prickly heat is another rash which is very common in summer and much better avoided if you can. That's there because you block your sweat glands, so you want to avoid getting hot and sticky. That means natural fabrics, loose floaty fabrics. Be a hippie this summer, and do make sure that if possible you get somewhere cool with the breeze on you fairly regularly. If you do get prickly heat, look on Patient UK for advice on what to do. What else do you need to think about? Well, if you're jetting off on your holidays, you do need to be prepared. It may be easy to get a plane ticket a week in advance, but have you had the travel immunisations you need? Most travel needs at least 8 weeks for the immunisations to work, and anywhere outside Western Europe, America, North America and Australasia, that's Australia and New Zealand, you do need to think about travel immunisations and sometimes malaria medication. It's really worth having a chat with your practice nurse, and she may say, if you talk to her on the phone, you don't need to go in and see her. Most of these things can be easily avoided, so let's make sure they don't ruin your summer.